Welcome, dear friends. Today we are going to learn about gastroretentive drug delivery systems, and in that we are going to see now different approaches for preparation of gastroretentive systems. So, first we will see what are the different approaches which are used. Okay, so this is your stomach, and basically this is the um, site which is preferred for administration of the dosage form. So we will see what are the different approaches which are used. The first approach used is the floating system. The floating system, it floats on the contents of your stomach. Next system is the mucoadhesive, the gastroretentive system. Okay. Next is the inflatable system, which is also known as swellable system. And last is the high density system. The gastroretentive system is also sometimes called as mucoadhesive system. So we will see these approaches one by one in detail. So first we will see the floating drug delivery system. The floating drug delivery system is also abbreviated as FDDS. So FDDS, it have a bulk density lower than the gastric fluid. Okay, the gastric fluid, it almost have density around 1. Okay, so the formulation, it should have density less than 1 so that it will float on the gastric fluid. Okay, so this FDDS, they have a bulk density lower than the gastric fluids, and thus they remain buoyant in the stomach for a prolonged period of time without affecting the gastric emptying rate. Okay, means what will happen even if there occurs the transit time. Okay, the contents from your stomach, they move towards your intestine, but as your system is floating, okay, it will not pass down to your intestine, but it will remain buoyant on the small amount of gastric content which remains back in the stomach. Okay, so the system, as it is floating on the gastric content, um, it will be unaffected by the emptying rate, and it will continue to release the drug slowly at a desired rate from the system. So after the release of the drug, the residual system, it is emptied from the stomach, and this overall, it results in an increase in the gastric retention time and a better control of fluctuation in the plasma drug concentration. So now if this is your volume of the gastric content, and if you take in the floating system, the system will float on the gastric content, and when there occurs the time for gastric emptying, okay, then the level, it will fall down. Now as the level is falling, but still this system, it will remain buoyant on that gastric content. It won't settle, or it won't pass into the intestine. Now let us see the advantages of this floating system. It improves the patient compliance by decreasing the dosing frequency. Better therapeutic effect of short half-life drugs can be achieved because again the dosing frequency is decreasing. Gastric retention time is increased because of the buoyancy. The drug releases in a controlled manner for a prolonged period of time. There is site-specific drug delivery to the stomach. It is easy to achieve. There is enhanced absorption of the drugs which solubilize only in the stomach. It is superior to single unit floating dosage forms. As such, microspheres, they release the drug uniformly, and there is no risk of dose dumping. Now let us see the limitations. High level of fluids in the stomach is required for maintaining buoyancy. Or you can say the float efficient working of the dosage form. It is not feasible for the drugs having solubility or stability problem in the gastric fluid. The drugs such as nifedipine, which is well absorbed along the entire GIT and which undergoes significant first pass metabolism, may not be a desirable candidate for formulation of floating drug delivery system because of the slow gastric emptying may lead to reduced systemic bioavailability. Limitations to the applicability of FDDS for drugs that are irritating to the gastric mucosa. Now let us see the formulation requirements. The device, it must comply with the following criteria. It must have sufficient structure to form a cohesive gel barrier so that it will maintain an overall specific gravity lower than that of the gastric content. The gravity of gastric content is almost 1.004 to 1.010. Okay, so our system, it has to have density lower than 1. Okay, then only it will remain bind on the gastric contents. It should dissolve slowly enough to serve as a drug reservoir. To date, a number of floating systems involving various technologies are developed, such as single and multiple unit hydrodynamically balanced systems, single and multiple unit gas generating systems, hollow microspheres, and raft forming systems. Based on the buoyancy mechanism, floating systems, they are classified into two types. The first class is the effervescent system. It includes the volatile liquid containing system, then matrix tablets, and gas generating systems. The next class is non-effervescent systems. It includes hydrodynamically balanced system, microballoons or hollow microspheres, alginate beads, lead tablets, which might be single lead floating tablets or double lead floating tablets. Now, first we will see the effervescent system. Effervescent system, the name itself is suggestive that effervescence will be created. Okay, effervescence or any type of gas is created here. So flotation of a drug delivery system in the stomach, it can be achieved by incorporating a floating chamber which is filled either with vacuum or air or with an inert gas. The gas can be introduced into the floating chamber by volatilization of an organic solvent. Example is ether or cyclopentane, or by production of CO2. CO2 can be produced as a result of an effervescent reaction between organic acids and carbonate bicarbonate salts. So these devices, they contain a hollow deformable unit that converts from a collapsed to an expanded position and returns to the collapsed position after predetermined delivery of the drug for prolonged time. Okay, so there occurs determined amount of time to permit the spontaneous ejection of the inflatable system from the stomach. Now first let us see the volatile liquid containing system. So suppose this is the drug, this is the dosage form. Once it moves inside your body, first it will settle into the gastric contents. Now, after coming in contact with your stomach, okay, this system, it senses the temperature. So at this temperature, the volatile liquid which is present inside that tablet or that chamber, it gets converted into gaseous state. Okay, now if you look at the tablet here, the volatile liquid, when coming in contact with the fluid, okay, this chamber, it consists of the volatile liquid, and this outer chamber, it consists of the drug. Okay, now once this dosage form is inside our body, the volatile liquid at body temperature, it undergoes volatilization. That is, it gets converted from liquid to gaseous state. Now, because of this conversion, this internal system or internal cavity or the chamber, it expands, and because of that expansion, the system, the dosage form, it will float on the gastric content. Okay, now as the internal chamber is expanding, the drug from the outer chamber, it will be released slowly at a predetermined rate from this polymeric membrane. Okay, and hence in this way we get a prolonged drug release. Okay, so this system, as we have already discussed, it comprises of two chambers having an impermeable, pressure responsive, movable bladder separation. The former chamber, it has got the drug and later has got the volatile liquid. To sustain the gastric retention time of the drug delivery system, an inflatable chamber, it has to be incorporated that carries the liquid. Now it is a volatile liquid, it will be either ether or it will be cyclopentane. So it turns into the gaseous state at body temperature, causing inflation of the chamber in the stomach. So it may contain a biodegradable plug which is made up of polyvinyl alcohol, polyethylene, etc. So this plug, it gradually dissolves, making the chamber release gas and to collapse after a specific duration to allow spontaneous release of the inflatable system from the stomach. So the drug continues to get released as the device is inflated or as it inflates. The next system is the matrix tablet. It can be formalized in a single layer matrix tablet by implementing bicarbonates in the matrix forming hydrocolloid gel agent, or in a dual layer matrix along with gas generating matrix together as an individual layer. The drug act as second layer. So there is possibility of a triple layer matrix tablet. However, now the gas generating matrix is one layer and the rest of the two layers are the drug layers. The next system is the gas generating system. So this system, we can say it is divided basically into three layers. The internal core, it contains the drug, which is enclosed inside a permeable membrane. Next comes the layer of sodium bicarbonate, and external layer is that of tartaric acid. Now, sodium bicarbonate and tartaric acid, they once they come in contact, they react to form carbon dioxide. Okay. Now, as carbon dioxide, it is a gas. It is forming inside your dosage form. So, because of that gas, the system, it will start to float on the gastric contents. Okay. Now, to avoid formation of gas in the packaging, to avoid that, sodium bicarbonate and tartaric acid, they are separated by a membrane, permeable membrane. Okay, and the outermost membrane is permeable and it is soluble membrane. Okay, now once your dosage forms, it comes in contact with the gastric juice. Okay, this sodium bicarbonate and tartaric acid, they will react to form carbon dioxide. Now, as carbon dioxide is being formed, it is a gas, this system, it will inflate. And because of this inflation, sorry, not inflammation, because of this inflation, the system, it will start to float on the gastric content, and then the drug will be released slowly through this permeable membrane, and nextly through this permeable soluble membrane. Okay, so in this way we achieve a slow and steady drug release, right? So based on production of so basically this system, it is based on production of effervescence. So it utilizes the effervescent reaction between carbonate or bicarbonate salts and citric and tartaric acid. So CO2 is produced in presence of water. So whenever a tablet is put in the beaker, okay, beaker, we can say uh, we use it to see how the drug dosage form will work once it is inside the body. So when you put the tablet in the beaker, first it will sink. Okay, now because of that water, there will occur a reaction between the bicarbonate salt and the tartaric acid to produce carbon dioxide and water. Okay, So with production of gas, it will rise up and it will float on the gastric system, and the drug will be released slowly. So this was all about effervescent systems. Now we will learn about non-effervescent systems. The non-effervescent floating dosage form, they have swellable cellulose type of hydrocolloids, polysaccharides, and matrix forming polymers like polycarbonate, polyacrylate, polymethacrylate, and polystyrene. So its creation has a simplistic approach, that is mixing of the drug with the gel, and it is followed by swelling by coming in contact with the gastric fluid after oral administration, and thus maintaining a relative integrity of the shape and keeping a bulk density less than 1. The dosage form, it gets its buoyancy owing to the air entrapped in the swelled up matrix. So this swollen up matrix reserves drug and maintains sustained drug release via the gelatinous mass. So hydroxypropyl methyl cellulose, HPMC, polyacrylate, polyvinyl acetate, carbopol, agar, sodium alginate, calcium, chloride, polyethylene oxide, and polycarbonates are the most commonly used excipients. So now first we will see the hydrodynamically balanced system. So it is a formulation of a drug with the gel forming hydrocolloids which are meant to remain buoyant in the stomach contents, and is also known as colloidal gel barrier system. These systems, they incorporate a high level of one or more gel forming highly swellable cellulose type hydrocolloids. Example includes HEC, HPMC, sodium CMC. So the drug dissolution and release from the dosage form retained in the stomach fluids occurs at the pH of the stomach under fairly controlled conditions. So suppose this is the uh, your hydrodynamic balance system, and once it comes in contact with the gastric content, it swells. Okay, so on coming in contact with the gastric fluid, it forms a viscous core. It incorporates water and it entraps air. So the density of the system, it falls below 1 gram per centimeter cube, and then it will start to float and the drug will be released slowly. Now the next system is the alginate beads. The spherical beads of approximately 2.4 mm in diameter can be prepared by dropping a sodium alginate solution into the aqueous solution of calcium chloride, which will cause precipitation of calcium alginate. So sodium alginate plus calcium chloride, it will give calcium alginate plus NaCl. So these beads are then separated, snapped and frozen in liquid nitrogen and freeze dried at minus 40 degrees Celsius for 20 to 24 hours, and it leads to formation of porous systems. Now this system, as they are porous, they maintain a floating force of over 12 hours. The next approach is hollow microspheres. The microballoons or the hollow microspheres, they are loaded with the drugs and they are prepared by simple solvent evaporation method. It is the commonly used polymers to develop these systems includes polycarbonate, cellulose acetate, calcium alginate, Utrecht S, agar, and pectin. These systems, they have capacity to float on the acidic dissolution media containing surfactant for about 12 hours in vitro. Now we'll see some different approaches, non-floating approaches. In non-floating, the first approach is mucoadhesive system. These are developed to perform the drug absorption in a site-specific manner. So in this approach, bioadhesive polymers, they are used which will adhere to the mucosal epithelial surface in the stomach. Thereby, they will increase the gastric retention time. Various mechanisms of adhesion are observed, uh, and these are as follows. The first one is the wetting theory. The ability of the bioadhesive polymers to spread and cause intimate contact with the mucin layers. So because of this, it gets completely wet. The next is the diffusion theory. There is physical entanglement of the mucin strand with the soluble polymer, or interpenetration of the mucin strand into the structure of polymer. Next is absorption theory. Here there is the biodigestion is due to the secondary forces such as van der Waals forces and hydrogen binding. The next theory is electronic theory. It proposes that attractive electrostatic forces take place between the glycoprotein mucin network and the bioadhesive material. So the bioadhesive material used are PAA, chitosan, sodium alginate, HPMC, sucralfate, tragacanth, dextrin, PAG, etc. The limitation of the system is bioadhesion is difficult to maintain due to the rapid turnover of the mucin in the GIT. The next non-floating approach is the swelling system. So these are the dosage forms which after swallowing, they will swell to an extent that prevents their exit from the pylorus. So as a result of this, the dosage form is retained in the stomach for a longer period of time. So these systems may be named as plug type systems since they exhibit the tendency to remain locked at the pyloric sphincter if that exceed a diameter of approximately 12 to 18 mm in their expanded state. The balance between the extent and the duration of swelling is maintained by the degree of cross-linking between the polymeric chains. A high degree of cross-linking retards the swelling ability of the system, maintaining its physical integrity for a prolonged period of time. Suppose this is the system, the swellable system. When this swellable system it comes in contact with gastric fluid, it will swell, and after that the drug will be released into the surrounding. The next approach is high density sinking system. So these systems, they have a density about 3 grams per centimeter cube, and they remain, or they are retained in the interim part of the stomach, and they are capable of withstanding its peristaltic movements. The only major drawback with such system is that it is technically difficult to manufacture such formulations with high amount of drug and to achieve a density of about 2.8 grams per centimeter cube. The next approach is the magnetic system. The dosage forms contain a small internal magnet, and the magnet is placed externally on the abdomen over the position of the stomach, that will help to retain the dosage form in the gastric region. But this system, it has got many disadvantages. The first disadvantage is that external magnet, it has to be positioned with high degree of precision, and also this system shows patient non-compliance, and hence it is not in use much. So this was all about the different approaches which are used in formulation of the gastroretentive dosage forms. So thank you for watching.